it is really confusing, I think, for a patient at first to know if their drug is working. And so that's one of the most common questions people ask us. How do I know this is working in my body? And so we have these measures that we use. It's called NEDA, no evidence of disease activity. So we want a patient who goes onto a drug to have no evidence of the activity in their body. And how do we do that? We ask them if they've had any relapses. So we don't want them to have any new MS relapses. We check the MRI and make sure they have no new lesions. And we look at their examination and we make sure that it looks stable, that there's no changes from the last one. So if they've met all those markers, then they've achieved NEDA, no evidence of disease activity. Some patients will say, how do we know that's not just me? How do we know it's a drug? We don't. But if you're on the drug and you're stable, we say that's great. When a person starts a new medication, they come in to see us usually about a month later because we want to make sure that they don't have any side effects, that they're remembering to take it, that everything's going okay with it. And then usually what we'll do is check a new MRI about 6 months after they start the medication to make sure that it looks steady, that there's not new active lesions forming while they're on the treatment. But we wait 6 months because most of our treatments take time to work. So they don't work right away. And so because of that, we give it a 6-month period of time. If that looks good, then we usually check MRIs every year. If a patient's doing well on their treatment, they usually can space out the appointments to every 3 to 6 months. Relapses are actually very infrequent now that we have very good treatments for MS. And so a relapse should be a signal to a patient and doctor that they need to think about the treatment they're on.